During a shoulder replacement surgery, also known as shoulder arthroplasty or total shoulder arthroplasty, the damaged parts of the shoulder joint are removed and replaced with artificial components. The procedure is performed to relieve pain and restore movement in patients with severe arthritis or joint damage. The surgery begins by placing the patient under regional or general anesthesia so they are comfortable and feel no pain during the procedure. The surgeon then makes an incision over the affected shoulder to access the joint. The surrounding muscles and soft tissues are carefully separated to expose the shoulder joint. Next, the head of the humerus, or upper arm bone, is gently separated from the socket of the shoulder blade. The damaged or arthritic humeral head is then removed. The hollow center of the humerus is prepared, and a metal stem is inserted and secured using bone cement. A smooth metal ball is attached to the stem to replace the natural head of the humerus. Attention is then directed to the socket side of the joint. The worn surface of the glenoid is reshaped, and a plastic socket component is implanted into the shoulder blade. This component creates a smooth surface for the metal ball to move against, allowing stable and pain-free motion. After the artificial components are properly positioned, the joint is tested for alignment and range of motion, and the incision is closed with sutures or staples.